And the first thing I really wanted to ask was really in relation to the aesthetic sector, which, has been going through a particularly difficult time, I think, over the last sort of couple of months with regards to looking at the government restrictions, which are still in place as well for certain aspects of treatments that we can or can't do. But could you explain really the impact that this has had on Qutis clinics since opening again?
Yes, well, I like to think that we're operating in a new temporary, because that's what my optimistic nature would have me do rather than say the new normal. But yes, we have, obviously, we risk assessed the whole clinics, we risk assessed each treatment and each, procedure, such as meet and greet, walk through, cleaning policies, all of those things. But I think what's occurred in our first month is that we have treated a month's worth of normal patients in 11 days. Right. And that was down to backlog. Now I realise there's always tomorrow to book somebody in that's desperately waiting for their my patients were telling me, didn't I realise there was a wrinkle pandemic out there going on, and I should be there to help. But that joking aside, we pulled out all stops. We haven't opened 7 days, but we put in extra hours, and there's been an awful lot of backlog. So the biggest impact to me as an individual was extra working and backlog. Yeah. We are seeing and triaging all of our patients via Zoom, and I like that. I like the fact that the new patients, or the patients that haven't been seen for a while, get to see the business owner, the practice owner, and then I can really set out where we are, what our qualifications are, and if you like, make sure that they feel safe in our hands. And I'm a big believer in repeating this mantra, safe in the hands of nurses, because our medical discipline is about care, nursing care, and many people want to feel that they're not just dealt with as a patient that is there to have a treatment plan and then a cure, but also a treatment plan with a care plan. And this is what I'm able to do virtually. There have been issues, I think, with the stop-start. Were we opening on 4th of July? Were we not? I think that then poses the question of how confident are you in this respect, me as the business owner and as a nurse professional, that you operate a medical model. And as you say, we've known each other a long time, and you quip about me calling myself an activist, but in the very beginning, when I got into aesthetics, I was out there defending my right to work as a nursing professional. Yeah. And unfortunately, in those days, it was really convincing doctors that we nurses could work independently and safely within the confines of a narrow specialty. Now, that came to pass legally when non-medical prescribing, which included nursing prescribing, came into being in the early part of the 2000s. So that followed well. Having always felt confident about the medical model and the nursing model, I never saw myself as a beauty nurse or as somebody who had sort of slightly gone down the track of just aesthetics. We are labelled as medical aesthetics, but definitely from a point of view of healthcare messaging, and everybody who is seen in our practice with a consultation, they will have a primary concern, a secondary concern, and then any other healthcare messages, because we ask about diet, we ask about hydration, we ask about social habits like smoking, exercise and drinking. And all of those things. I've been consulting all morning, and there's been a lot of people that are now wanting to lose weight. Now, we don't offer any weight loss treatment modalities within our practice. We offer things like cool sculpting. It's not exactly weight loss, but I am watching the sector, because definitely people who have been a little bit heavier need to lose weight. So, you know, I've got my book at the side and saying, take a read of this. If you want some help with losing weight for your health, we're giving that sort of message as well. And I think we've exchanged a few emails and communications during the time of lockdown, whereby it seemed very wrong to go on Instagram and to try to talk about treatment sales or before and afters. So I very much was of the opinion that we should be talking about health messaging, how to bring your shopping in, what to do with the Amazon delivery. Do you clean your keypad if you've got a keypad on a gate before you come in? All of those sorts of things. So we gave those sorts of messages, and you know, they were taken up in the industry. Cool Sculpting took one of our messages up, and It's Clinical took our messages up, and it was, I think, a worthwhile thing to do.